Welcome to Hale and Hearty Horses. So this is a space where we explore the science and the art of holistic medicine. I'm Dr. Rebecca, and today we're diving deep into craniosacral therapy for horses. So not just the gentle touch that you've probably heard of and that you've seen, but the science, the applications for injury and illness, and how it can help us find underlying problems before they become obvious. Do you want your horse to be strong, healthy, vibrant, and resilient? Do you want to proactively prevent illness and injury and have your horse recover with ease when challenges do arise? Welcome to Hale and Hearty Horses, your trusted hub for equine wellness and holistic care. Hi, I'm Dr. Rebecca, and I'm your host. Let's get started. Craniosacral therapy, or CST as it's often abbreviated, can be misunderstood. Most people think it's just simply a soft touch technique, but behind that really gentle hand work is a system of profound diagnostic and therapeutic value. It's a therapy that interacts with the horse's fascia, their nervous system, and fluid dynamics in ways that we're really just scientifically beginning to understand. But today we're going to explore what CST really does on a physiological level and how it can support rehabilitation and how it can even act as an early warning system for issues that might otherwise go unnoticed. At its core, craniosacral therapy works with the craniosacral system, which includes the membranes and the cerebral spinal fluid, the surrounding area, the brain, and the spinal cord. This system acts like a protective, lubricating, and regulating network for the central nervous system. In horses, dysfunctions or restrictions in the system can affect mobility, nervous system function, and even organ health. One of the key mechanisms of craniosacral therapy is how it taps into fascial connectivity. So fascia is all of the soft tissue, connective tissue that envelops every muscle, bone, nerve, and organ. And it's continuous throughout the body. We talked about it in the podcast about acupuncture because acupuncture is really good at working with the myofascial system. But craniosacral therapy is also really good at working with it because this continuous fascial system throughout the body can mean that tension in one area, say the pelvis, can affect the neck, the jaw, the hind leg. And craniosacral therapy allows practitioners to identify these tension patterns and gently release them, improving fluid flow, reducing compression forces on the nerves, and restoring mobility. There's also an emerging body of research suggesting that craniosacral therapy can influence the autonomic nervous system. By stimulating parasympathetic activity, the horse's body can move from a stress-driven state to a restorative state, improving healing, immune function, and even the horse's focus. So a lot of times when you see craniosacral therapy being done, you'll notice that the horse becomes very relaxed. They start to get very zen-like, and they'll have a lot of releases from this very gentle, soft touch. Craniosacral therapy isn't just about loosening the muscles, and it's not just about this soft touch, and it's not just about the cerebral spinal fluid, but it's all about rebalancing the nervous system and the body's self-regulatory capacity. So even though we'll see horses relax a lot when we're working on them, it's not just about this. It's not just about relaxation for the performance horses. It actually has real implications for illness and injury. So a lot of times craniosacral therapy can be used with musculoskeletal injuries because it can help detect restrictions that contribute to chronic patterns like chronic stiffness or even to subtle lamenesses or compensatory patterns. For example, with a horse with a past stifle injury may also show fascial tension along the spine or the neck. And addressing these patterns can accelerate both the rehabilitation and also prevent secondary injuries. We always talk about those compensatory patterns being one of the main reasons that horses don't come back into full work or re-injure themselves after they're back into work. Craniosacral therapy also has this function in post-surgical cases where it helps support fluid movement, reduce adhesions in the fascia and in scar tissue and in connective tissue, and encourage that nervous system balance, all which can improve recovery outcomes and actually help the recovery go a little faster. Craniosacral therapy also can be used in chronic illness, so especially horses with neurologic disorders or digestive system problems or systemic inflammation can really benefit from craniosacral therapy because they will carry those tension patterns that perpetuate all those symptoms. And it can help reduce the stress on the nervous system, supporting the body's natural healing process. Advanced practitioners often combine craniosacral therapy with other modalities like massage, acupuncture, even movement therapy to maximize recovery. And in fact, CST can act as a map by identifying subtle restrictions in the craniosacral system, in the rhythm, in the fascial tension that helps therapists pinpoint areas that need targeted rehabilitation. One of the most fascinating aspects of CST is its ability to reveal hidden dysfunction. I think most of this is through the fascial network, but when you learn CST, you're really learning about the rhythm of the cerebral spinal fluid flow. And you can use it, though, throughout the entire body. And you're connecting the entire body. So anytime that you would feel tension in one area or feel a restriction in one area, it can also indicate problems elsewhere. So a lot of times, for instance, we would see that issues with the sphenoid bone would also have issues with the sacral bone. Skilled practitioners actually detect these patterns, and a lot of times we're able to feel and see things before pain or lameness actually appear. For example, there can be tension through the lower thoracic lumbar region that suggest issues in the hind legs or in the hocks or in the stifles or even in the SI joint. We can feel restrictions in the neck fascia that can help us identify things going on with dental problems or the TMJ or even sinus issues. And we can find subtle asymmetry in the craniosacral rhythm that can indicate neurologic problems, trauma, chronic illness, or organ dysfunction. So I say that a lot of times when I'm feeling for that craniosacral rhythm, that it will just not be there at all, or that the amplitude can be different, that it can be slow, it can be fast, it can be large, it can be small, and all of those variations from what would be like normal help indicate where there's a problem in the body. So by understanding these patterns, practitioners can actually use craniosacral therapy not only as a treatment, but also as a diagnostic tool, and helping horse owners and veterinarians identify underlying problems earlier than traditional methods might show. So I might be able to feel that something isn't quite right long before that actual lameness or any sort of diagnosable illness actually presents itself. This has happened a couple times with me in having a horse with Lyme disease or EPM or even some tendon and ligament injuries. So of course, craniosacral therapy is the most effective when it's integrated into a broader care plan. So that's what we talk about in all of the holistic medicines, is that it's not just one medicine is the end all be all, but that we're looking at the entire horse. And that is going to include veterinary checkups and diagnostics. It's going to include nutrition that actually supports the connective tissue, the nervous system health, and the cranial system, the craniosacral system. That plan includes appropriate movement, training, and rehabilitation, and other body work modalities like Tui Na, acupuncture, acupressure, massage, chiropractic care. It's also important to recognize that each horse is going to respond differently. Some may show immediate relaxation or improved movement, and others may need multiple sessions to release long-standing patterns. The key is consistency, to be really observant, and to work with someone that can help you learn this system yourself. I've noticed on horses that I've worked with that after a period of time, so after repetitive sessions with them, they may in the beginning have been unsure of touch. And after working with the craniosacral system a few times, they absolutely love touch. And I see this a lot with the sensitive fillies on the track. It's a way in to get them to learn that touch can be a good thing and that touch can actually help them release. And part of that is why I think that craniosacral therapy is a window into the horse's internal world. So it's very subtle. You're staying under their brace. It's such a soft, gentle way to work with the horses that they're not bracing against you. But it has all that scientific evidence behind it that really makes it an effective therapy. And you're able to deeply connect to the horse's body's intelligence. When you're able to tap into that intelligence is when you're able to detect tension patterns, when you're able to support healing and even prevent injuries before they become a long-standing bad problem. Think about if you were to know that your horse maybe had a strain in an area long before it actually became a tear or a hole in the suspensory or a hole in the tendon, that there was actually a strain there first. That's the subtlety of craniosacral therapy. So science and theory can tell us a lot about how craniosacral therapy works, but nothing brings it quite to life like actually seeing it in action. And over the years, I've had the privilege of working with many horses, from performance athletes to backyard horses to rescue horses. And each one has taught me something unique about the subtle power of CST. So I want to share a few stories from my own hands-on experience where craniosacral therapy revealed hidden tension patterns or facilitated really remarkable releases, and even helped uncover underlying issues that weren't obvious at first glance, so that the owner or the trainer or the vet had not picked up. These moments really highlight why listening to the horse's body and trusting its wisdom is really at the heart of this work. Working with craniosacral therapy taught me something that goes far beyond technique. It taught me to truly feel. So when I got out of school and I started practicing, I really felt that I needed a skill that allowed me to connect with the horses on a deep level where I feel like they could talk to me and tell me what was going on, because I couldn't have a conversation with them and ask them. And craniosacral therapy really was that window for me, or that door, that opening to that type of practice. Because as I learned and I placed my hands on the horse, I learned to sense that subtle rhythm in their body and that flow of the cerebrospinal fluid and the micro movements in the fascia that most of the time went completely unnoticed in other practices and in other therapies. Over time, this quiet, attentive listening developed into a deep sensitivity to the horse's energy, which then I was able to apply to the Chinese medicine side of my life and into meridians and acupoints and the flow of the meridians. I began to notice areas where tension was being held. Sometimes that tension had been there for a really long time. And I was able to see how that tension influenced the posture, the movement, and even the behavior of the horse. This ability to feel allowed me to provide owners with insights that they might not be able to see themselves. For instance, pointing out that a horse's resistance on one side just wasn't muscular, but linked to a restriction along a specific meridian or a specific craniosacral holding pattern. I also could start to see where maybe a horse was sore on one side because they were compensating for something going on the other side. So you'll see this a lot with some asymmetries in the hind end, that you'll find that one hind leg is really the problem leg, but it's not the sore leg. By using the other limb more, the other limb would get sore, but actually the real deep-seated problem was in the other limb. It helps if I talk left and rights, but you understand what I'm saying. So with that ability, I was able to guide owners and trainers and veterinarians in understanding where their horse was holding physically and energetically, and what kind of support would help them. So what kind of body work or movement or even emotional work that might help them release this pattern. It really transformed the way that I approached horses, because it had me seeing them not just from the acupuncture and the Chinese medicine perspective, but also to see them from a touch energetic. They were able to communicate through their bodies. And it also allowed me to open the door for owners and trainers to be able to see and understand their horse in a whole new way. So over the years, my ability to feel through craniosacral therapy has led to some really remarkable experiences. There were multiple horses where I picked up subtle energies or subtle areas of tension or holding that later the vet confirmed were injuries in tendons or ligaments. Now, I wasn't always able to say it was this tendon or it was this ligament, but I would be able to give them a part of the body to look at. So a very specific area for them to look at without me being able to say, oh yes, it was definitely this structure. So I didn't give me like X-ray vision or ultrasonic vision, but it did really help the owners and the trainers when they had these subtle things that the horses weren't quite right, where to then direct the vet to start doing diagnostics. And it was amazing over the years how many times I was correct. It even amazed me. Some of these things were not obvious. And with this work, I was able to help guide where to really find the problem. On other occasions, sensing these areas, being able to feel these areas allowed me to advise owners to pursue different veterinary options, which led to more accurate diagnosis. And this was like before the problems became super serious, before they were lame, before they had a major injury. One of the other things that I noticed is I was also able to track recovery in the horses coming back from injury. So by reading the craniosacral rhythm and fascial patterns and energy flow, I could tell when a horse was ready to return to work. And equally important, if they still needed some more healing time. And beyond that, it gave me like real-time feedback on my own treatments. So when I first start working with a horse, I sort of tune in and I kind of feel everything. And then as I'm working on them, I want to go back in and check in on those areas and say, is this working? Does this feel better? In Chinese medicine, we take the pulses of the horse and we look at their gum color. And of course, we palpate points and all of that. But this was just another tool to be able to say, yes, now I feel that this area is improved. Even while I'm there, like in real time, so that I could say, no, I need to do a little bit more here, or this isn't working like I thought, and I would have to go back to the drawing board in my brain a little bit and come up with a different approach. So it really helped me to see whether what I was working on was being effective, or if more sessions or a different therapy were needed. So these experiences really reinforced something profound. That craniosacral therapy isn't just a tool for relaxation. It's diagnostic, it's monitoring, it's an integrative tool, and it allowed me to feel what's happening beneath the surface, like to be able to guide owners with informed insight and help horses really recover and perform at their best, all while supporting their long-term health and balance. It's every day I use this tool in my practice. Every horse that I touch, I use this tool in some way, shape, or form. And while some owners may see craniosacral therapy as a party trick or even psychic, the truth is actually far more grounded. So I get a lot of questions because people want to test my knowledge or test whether I can figure it out. And I really think that people sometimes think, I just think about it and just pops in my head, like that it's super easy to do, or that it's psychic, or it's some sort of trick that I've learned. And no, it is actually far more demanding. Of all the therapies that I perform, craniosacral therapy is the most demanding on me physically. I can go out and work outside doing heavy labor stuff on the farm and be nowhere near as tired at the end of the day as I am if I'm doing a full barn of horses where I have to do a lot of craniosacral therapy. Reading the horses' patterns, their rhythms, and their meridian flow requires such a complete presence, an intense focus, and sustained energy on my own part that every session, it takes its toll on me. And because you really have to tune into the nuances. They're almost imperceptible. So you have to really, sometimes for long periods, you really have to be able to tune in. And I think this is energetically, mentally, and physically exhausting. This is one reason why there is so much burnout in the field, not just in craniosacral therapy, but in any body work field. The work is not effortless. It's not mystical. It's a professional skill that you've had to learn and hone over years and years of practice. And it can be both demanding as a discipline, but just of your general energy. Recognizing this effort in all healthcare fields is crucial for the horse industry, for owners, for trainers, so that you're honoring the practitioner's presence, their time, and their care. It's just as important to respect them as it is to respect the horse. And by valuing the practitioner's energy, owners help ensure that the sessions stay safe, they're effective and sustainable, allowing both the horse and the therapist to benefit from this subtle but profound work. And the reason I say that is a lot of times that it's even harder on us as practitioners if there's a lot of commotion in the barn, if the horse is worried about where its friend is or who's coming and going, or that they're feeding. It takes so much presence to actually do this work that if there's a lot of chaos in the barn, even certain owners can be like really energetic and create chaos. There's such a presence and such a concentration that goes into this work that any sort of extraneous thing like that can make it much, much harder. So while craniosacral therapy relies on the practitioner focus and the practitioner energy and the practitioner experience, the horse's daily environment and the owner's attention also play a huge role in maintaining and supporting the releases that happen during a session. So it's not just that we need the time during the session to be quiet and allow us to focus and allow the horse to really get deep into their body and to release things, but also we really need that after session to be supportive as well. So I always encourage owners and trainers to be really present with the horse, to notice those subtle shifts in the movement after the treatments and the day of, the next day, and subsequent weeks, and to really respond thoughtfully to the horse's body language to reinforce the work that we do as practitioners. In other words, I don't want the owners to be just passive observers, right? I want them to become partners in their horse's healing and balance, and to help extend the benefits of the session of the craniosacral therapy beyond the actual time of the session itself. So developing that presence themselves, developing that observation to look at these subtle things, even if they're not putting their hands on their horse and actually doing craniosacral therapy, they can start to develop the connection with their horse that is fostered in the session and then extend that beyond the session. As an owner, you don't have to be a practitioner to help your horse benefit from CST. The key is, like I said, just paying attention and being present with your horse. After a session, you want to notice, how are they moved? Where do they seem more relaxed? What areas of their body feel softer when you touch them or even when you work them? Like, how are they in their work? Are they more supple? It's often the small changes, like the horse is more relaxed in the neck, is softer, lower head, a lighter step, more easily bending, warms up easier, all those kind of things that tell you the body has released a certain amount of tension. So here are 3 simple steps that you can take to become more in tune with your horse's craniosacral system. So one is, I've said it multiple times now, to slow down and observe. Take a few minutes each day to watch your horse stand, to watch them move, to watch them stretch. Look for subtle shifts in posture, weight distribution, or even stiffness. The second one is tune in to touch. Place your hands gently on your horse's body, on their neck, on their back, on their pelvis. Notice areas that might feel tight, that might feel warm or restricted versus areas that feel soft and relaxed. You don't need to diagnose, right? You're just paying attention, and it helps you and your horse communicate. So one of the ways is like just to realize that palpation doesn't have to be deep. When we do craniosacral, we are actually touching the horse, but a lot of times it's like the weight of a paperclip is the amount of pressure that we're putting on them. So it's not like deep massage therapy, and there's so much that the body can tell you with that light touch. And the third way then is to notice patterns over time. So sometimes it helps to keep a journal, what you see and what you feel, but over weeks, you'll want to start to notice patterns. Maybe your horse carries more tension after certain work, or certain areas release after the therapy, or after turnout, or after they get out and move around. So this helps you as the owner, but also me as a practitioner, make informed decisions of how to support the horse's health in the future. And it always gives us good feedback to know this was really much, much better, but we still need to work on this other area. So by taking these steps, owners can actively participate in the horse's well-being, in their healing process, and even in the craniosacral therapy and in that subtle work, and actually help build a deeper connection that just goes beyond training and performance. So by paying attention to your horse, to tuning into those subtle shifts in their body and tracking patterns over time, you're not just supporting their health, you're also learning to read their body in a way that complements the work of your practitioner. These daily observations and mindful interactions allow you to become an active partner in your horse's well-being, reinforcing the releases and balance achieved during the craniosacral therapy sessions. As we wrap up today's episode, I want to take a moment to reflect on the bigger picture. What craniosacral therapy can teach us about the horse, about ourselves as caretakers, and about the connection that exists between them. Today, we've explored craniosacral therapy from multiple angles. The science behind it, we briefly touched on how it works with fascia and the nervous system, its applications for injury, illness, and recovery, and the subtle ways it reveals tension and imbalances in the horse's body. We also touched on how important it is that the practitioner have the quiet time to work with your horse where they can stay balanced and they don't have to exhaust themselves energetically to get the job done, and how owners can actively participate in their horse's well-being by observing, feeling, and tracking patterns over time. All of these pieces come together to show that craniosacral therapy is much more than gentle touch. It's a tool for communication, healing, and prevention. Craniosacral therapy is a partnership between your horse and your practitioner, and between the practitioner and the owner. While the work can be subtle and requires significant focus and energy, it offers profound insight into the horse's physical and energetic health. Owners who take time to tune into the horse's body can notice those subtle changes and honor the practitioner's effort by helping extend the benefits of craniosacral therapy far beyond the actual therapy session and help support the long-term balance and wellness of their horse. If there's one thing to remember about today, it's that craniosacral therapy is about listening to the horse's body and honoring their wisdom. What we basically do as practitioners is we are tuning in to certain holds, certain body parts, and you actually, once you get good at it, you can extend that to almost every body part. And you are subtly waiting for feedback about that part from the horse. And then you are reading that feedback with your hands. It's a very, very subtle thing. You are tuning into the craniosacral rhythm and you are tuning into the energy of that particular part that you are focused on. So a lot of it has to do with intention. And so presence is key. Observation is key, and patience is key. A lot of times I'm just following what the tissues are doing. So I put my hands on the horses, I am engaging a certain tissue with this very light touch, and then I'm following that movement that is going on underneath my hands. I'm following it to moderate the craniosacral rhythm, to bring function back to the rhythm and to the area that I'm working on. And it's all done with this very subtle touch. And it causes these releases in the body. And I will be able to read like right before a release is going to happen because it's sort of predictable like what the horse does. And especially once you get to know the horse, because they'll have very specific patterns that they do right before they're going to release. But those releases then allow me to go deeper and deeper into either the structure or into the horse's pattern or into their compensatory pattern as I continue to work in that spot and throughout the body. All of this can just give you, the owner or the trainer, some insight into your horse's health and give you some feedback about where things might be not working as well as they should. And you can apply that to your daily care of them, but you can also apply that to your riding and training. And it also can deepen the communication between you, your horse, in such a subtle and powerful way. So I encourage you to explore craniosacral therapy with kind of an open mind and a curiosity, to seek out a qualified practitioner to help you, to pay attention to your horse's responses, to learn how to hold presence with your horse, and to also consider how you can integrate the insights that you get from a session into your horse's overall care. Over time, you'll begin to see those subtle shifts in your horse, and you'll be able to translate that into their comfort, their mobility, and their balance. And you'll start to really understand how much horses communicate through their body if you listen quietly enough. I think that horses are very communicative, but a lot of times we miss it because it's subtle. And the one thing about craniosacral therapy is it will teach you to have the patience and to listen to the subtle. Because at the heart of craniosacral therapy is this simple, profound idea that listening to the horse's body with respect, patience, and presence is utmost. Every subtle shift, every release, every tension that is eased is actually a message. It's a message from your horse. It's a glimpse into what the horses experience in their body, and then is a message to tell us how we can support their ultimate health and top performance. As owners, as practitioners, and as lovers of these incredible animals, our role is to pay attention to that, to honor the wisdom of their body, and to work alongside them with care and intention. And when we do this, we're not just helping a horse heal or perform better, we're actually deepening the connection that goes beyond words. It goes beyond the training. It goes to a place of trust, a place of balance, and a place of mutual understanding. That is the true gift to both me personally and to every horse that I work on. That's the gift of craniosacral therapy. Thank you so much for joining me today. This is Dr. Rebecca again, and you've been listening to the Hale and Hearty Horses podcast. Just a reminder, you can find me on TikTok for daily advice on keeping your horses happy and healthy. I hope today's discussion has given you new insights into craniosacral therapy and how you can support your horse's health, balance, and well-being. Be sure to join us next time as we explore more ways to care for your equine partner with knowledge, compassion, and a holistic approach. Until then, stay curious, stay connected, and keep supporting your horse's ultimate health.